Hello, this is Chris from the Obstacle Doc, and today we are going to talk about foot intrinsic and toe coordination. So this is really important because when we think about the foot, oftentimes we want to draw the same analogy to our hands and all the dexterity and the motor control that we can derive from our hands, we can also achieve from our feet. And this is important when we think about walking and running and just, again, coordination of using our foot actively and dynamically during those locomotive movements. So just from an education standpoint, what I want you to appreciate is the foot itself, if we kind of mushroom down to this level, has two compartments of musculature. One compartment controls the big toe by itself, and then another compartment controls the lesser or smaller toes as well. So just like our thumb and our fingers, we should be able to dissociate these two compartments. This is a great kind of teaser drill for clients who have had histories of ankle injuries, foot injuries, post-operative cases, especially if you've been booted or immobilized for a while. A lot of times the foot will kind of go on vacation, get a little weak, get a little dumb, get a little lack of coordination. So this drill is pretty simple, the following. So starting in sitting where weight bearing is reduced, we want to standardize any other hip and leg movements, so the hips and knees are not going to move. And what I'm going to tell Daniela to try to do is keeping her little toes on the ground. She is going to try to actively pick up her big toes at the same time. Good. You can do these individually, you can also do them together. Sometimes doing together is nice because you can see a potential and even feel a potential difference between your feet at the same time. Again, we're checking and balancing movement from above because we don't want to use our legs to create the motion. After that, we're going to go the opposite direction where we're going to keep the big toe down and we're going to try to lift the little toes up. They are going to come as a unit. They may not all come up at the same rate, but that's okay. A lot of times the little one lags a little bit. And then now we're going to put all that together and we're going to do what we call kind of toe yoga, where we're going to toggle back and forth. Big lift, little lift, big lift, little lift. Again, trying to actively coordinate the different compartments of the foot. Progression model is going to be the following. So we're going to add weight or load to this, which is going to simulate more of the active coordination demands of being upright, again, for standing, walking, running, etc. In a typical standing position, feet shoulder width apart, we can do the same thing. Again, big toe lifts versus little toe lifts. Again, looking for differences between the two sides. And then as the person gets even better with that, we're going to transition to single leg. Single leg transition, we're going to hold. You can use a wall or a countertop. Danielle is going to use me for stability. And again, we're going to try to toggle between the big toe lift and the little toe lift. And then the ultimate goal is not holding and being able to balance and trying to coordinate at the same time. This is particularly important when you think about runners. Running is a 2 to 3 times body weight force impact when we hit the ground. So we really want that foot to be able to control that impact and to be able to kind of, with vitality, kind of coordinate and push itself off the ground. So if you go to full single leg and you can't move those toes, that's a little bit of an indication that your load rate is exceeding the performance of the foot. And ultimately we want to be able to withstand really our body weight and beyond. In terms of dosing, low effort, all things considered, more of a brain teaser. So high rep sets, 10 to 20 in a row. You can progress from the sitting to the standing. You can do that right away too. The challenge is kind of good to kind of play with. Just like any kind of skill, we want to try to work on this pretty frequently. You can do this definitely every day. Looking for learning curves to occur probably over a couple weeks. So be patient, even if it might get a little frustrating because it can be a little hard on the early part, but they will wake up, they will get better. And again, we're working on building up our toe coordination.